Hello, this is Dr. Pat Sharp with Neuroeducation, and today's little talk is about anxiety in teens. There's several causes, and they're kind of typical for all mental health disorders. One is, it's something that's happened outside in their world, so otherwise environmental kind of thing, some kind of a traumatic event. And again, it doesn't have to be a great big thing like witnessing a murder or something. Sometimes it can be something they've seen on television that lingers and festers and creates an anxiety situation. More typically, it's a whole combination of things that kind of create this onslaught. And of course, at this age, and during the teenage years, there's a whole lot going on in their life, and that can kind of be overwhelming for them. The more common cause of anxiety disorders is just their wiring. It's something internal to them, and of course, it's neurological. Typically, it's kind of this overactive amygdala, the two areas in the brain and the base of the brainstem, that they're kind of in charge of oh no kind of reactions. So, but it's kind of overactive. It's going oh no way too often. The main difference in an anxiety disorder that's diagnosable is that it is extreme and it doesn't fit the situation, and it's persistently an overreaction to some perceived threat. Good news is it's very treatable, very effectively treatable. Sometimes, with the cognitive behavioral treatment is probably the best route to go. It's learning about how to think about what I'm being reactive to and changing my behaviors by changing my thoughts. And it can also be helped by medications, although it doesn't absolutely have to be treated by medication. And in our work with teens with anxiety disorder, we don't start with medications. We start with behavioral treatment. So the prevalence is really quite high. It's higher in this population than it is any other age group. 25% of all teens are diagnosed with some form of an anxiety disorder in their lifetime, and 6% of those are pretty severe, like really life impairing. And twice as many girls during this period of time are diagnosed with anxiety as boys. So it's more common among the girls. It's not a temporary feeling. It's not something that just kind of comes and goes. It's long lasting, and it can get worse over time if treatment isn't sought. And that's an important thing to keep in mind. It significantly interferes with daily activities. Now, one of the reasons why it hits teens so much more than the rest of the population is that there's a whole lot going on in the brain at this stage in life. And one of the big things is the whole change in melatonin levels. And the melatonin is like the sleep hormone. It's the thing that kind of makes you feel drowsy at night. And when those melatonin levels drop down in the morning, it wakes you up. Well, theirs don't drop. They don't flare up to make you feel sleepy in a teenager, because the brain is working so hard to do all this growth and development stuff in the frontal lobes, so that they're not able to fall asleep until 10, 11, 12 at night. And then, of course, it doesn't kick back down again like in a other age brain until way later in the morning. So, in fact, I hate to say this, but our whole educational system is really miswired for teens, because they should be starting school way later and, of course, going way later in the day. And they do a whole lot better, because typically they need about 9 to 10 hours a night of sleep. And almost no teenagers are getting that much sleep. So they become irritable. And, of course, that leads to anxiety and also depression. The two are kind of quite related. So this big thing that's going on in the prefrontal lobes of the brain is this planning and prioritizing and controlling my decisions and stuff. And parents have always been their kids' prefrontal lobes until they get to be about somewhere in that teenage range of ages. And at that point, the kids want to be able to take on that and use their developing prefrontal lobes. And it's kind of a delicate little balance about how much do I let them make these decisions and make a mistake, and how much do I just keep being their prefrontal lobes. But the fact is, if you keep making all the decisions as the parent, they'll never learn how to trust and use their own, and it'll increase their anxiety, because they'll feel like, I can't do this, it's too much. So that's a delicate balance that's worth talking about. Now, here's some facts. Obviously, the biggest base for developing an anxiety disorder as a teenager is school. It's a huge stressor. That's why we see less kids in our clinic as teenagers for anxiety in the summer, because it drops away. It's like, oh, it's not a problem after all. Well, it is. It's just the stressor has reduced. And the second biggest stressor is home things, the home. And that has to do typically with that battle about, I want to be my own boss. I want to be my own prefrontal lobes. And the parents saying, no, you can't, because you can't make those decisions yet. So there's a lot of conflict there going on. So anxiety actually far surpasses the diagnoses of depression in this age group. Anxiety is the most common mental health disorder in teenagers. And sadly, only 1 in 5 teens will actually seek treatment. And I think one of the reasons for that is that during the holidays, Christmas holiday, spring break, summer vacation, it looks like it disappears. So people think, oh, it's not a problem. But if it's left untreated, it can really lead to more serious handicapping kind of disorders like, the obsessive compulsive kinds of things, like the hand washing because of the anxiety, the fear of germs are going to invade my body, which is unrealistic, when they're washing their hands 20 times a day. And of course, anxiety in a teen can make them more prone to depression. And so then you have more of that going on. So what's important here is to not try and guess this as a parent, but to actually find out, is there really a problem here? Or, is this just kind of falling in the range of normal kind of reaction to life as a teenager? So in order to make a diagnosis, you need to see a qualified mental health professional that will evaluate their symptoms, the course of their history for the last 6 months. They're going to rule out other causes that might be contributing to what the behaviors are that you're seeing, like are there other medical conditions that maybe you weren't aware of, or are there other psychiatric, perhaps, disorders that might be causing some of this? And or substance abuse can also mask itself as looking like anxiety. And then they'll also determine the level of impairment in the teen's functioning. And all of that will then guide our decisions, or the mental health professional's decision about treatment. And that very good news, again, is it's very treatable. Most everyone we see for treatment of that disorder as teens improves significantly in a fairly short period of time with therapy and sometimes with medication, but it doesn't always need medication. And then there's other supportive treatments as well, and I've listed some of those here. And these are also all things that can happen with a mental health professional. Now, I'm closing out here with 2 fabulous resources for learning more about anxiety. Check out this webpage for resources to recover. It's got a whole list of websites and blogs and books and movies and documentaries about anxiety. So it's a great place to learn more about it. And it's a great place to peruse with your teen that you're worried about. And then, of course, the gold mine of anxiety and depression disorders and information about it is the Anxiety and Depression Association of America webpage. And I've listed that there for you. So, best of wishes to you, and thanks for listening today.